What can a business do with inconsistent, scattered, fragmented data? The answer is get yourself a strong data analyst. A data analyst who specializes in collecting, cleaning, analyzing, and presenting the data. As a senior data analyst specializing in the healthcare industry, arguably one of the most challenging fields for data management, I've honed the ability to handle complex, highly specialized, and often fragmented data. I've worked with experts in the field and gained skills that are rare to find anywhere else. And one of those skills is creating an optimized workflow for healthcare data at a startup managed care organization. In my role at the MCO startup, I specialized in transforming complex data sets into actionable insights, enabling end users to collaborate more effectively with stakeholders. Because of how complex the data is, in addition to the large volume of daily ad hoc reports, an optimized workflow is imperative to executing requests accurately, timely, and effectively. Today, I'll walk you through how I handle daily workflows that simplify even the most complicated tasks. Allow me to map out the scene in a claims operation. The data I collect is processed claims. My end users are claims analysts. The stakeholders are providers and healthcare groups. Here's where I start. The collected claims data comes processed from a healthcare payer system and stored in our SQL Server data warehouse. This warehouse is a centralized repository where all claims-related data is organized and maintained. To retrieve this data, I use two primary methods. First, I could resort to writing and executing SQL queries in the SQL Server Management Studio. This extracts data directly from the plan database. The second and faster method is using the Power BI workspace, which is connected directly to the SQL Server warehouse. Through the workspace, I can use pre-built dashboards and use interactive filtering options to retrieve data. My team especially loves this feature as it's efficient for recurring report requests, reducing the time it takes to bring data to end users, thus saving insurmountable time and money. The claims analysts, my end users, depend on clear and accurate data to perform their roles. They, in turn, communicate with healthcare groups and providers, the key stakeholders in the claims process. Because of how important each part of the process is, my goal as a data analyst is make sure these reports are not only timely and accessible, but also comprehensive and easy to interpret. This allows the claims analysts to provide stakeholders with the clarity they need for informed decision-making. Here's the challenge. Working with health insurance claims, data requires precision and efficiency. Each report I generate can contain close to 100 fields. Yet, these complex reports are crucial for claims analysts who need accurate information. So how do I ensure that they receive this data promptly and in an interpretable format? That is where a high-performance workflow is needed. My workflow routine begins by logging into the communications channels. This is where I receive ad hoc report requests. These requests often focus on specific provider TINs, NPIs, healthcare group names, service codes, or mod codes. Sometimes they involve multiple filters, structured by date ranges. Once I have the request, I retrieve the data from our Power BI workspace or SQL Server Management Studio. I then input the data into Excel, where I create pivot tables that summarize the information for end users. From request to delivery, this process typically takes just 5 minutes, demonstrating both the efficiency and technical expertise of my team. By streamlining this process, complex data is collected, managed, and handled in a timely manner, which has drastically cut down costs and time to resolve high-ticket client requests. Thank you for watching. If you're looking for a data analyst who can manage complex workflows and deliver high-quality insights on time, let's connect. I'd love to help your organization turn data